Hi, my name's Angela James of Sydney Pelvic Clinic, and this video is about how to best prepare your pelvic floor muscles for labour. So during pregnancy, women hear a lot about tightening and strengthening their pelvic floor muscles, which is really important to avoid things like incontinence or prolapse and give the pelvic girdle more support. But once we head towards the end of pregnancy, so from about 36, 37 weeks, the demands on the pelvic floor change. So it's now starting to prepare to deliver the child. And what that actually means for your pelvic floor, if I can get my model, if we look here at the pelvis, and then if we come and look at the superficial muscles, so this is looking from the ground up and removing the skin, what you can see, just to orientate you, you've got your pubic symphysis here, you've got your clitoral area, urethral area, and then that's the vaginal opening. So in terms of what's required of the muscles, it's limited in terms of how much it stretches at the front because of the pelvic arch, and that's really important because it protects these important functions at the front. So what needs to happen is the stretch occurs at the back. So if you think about that, we've got muscles that run along here called your pubococcygeus, goes from the pubic bone and comes back towards the coccyx, and your puborectalis, which links around the rectum, and then your perineum area, which is this kind of thick fibrous area between the vagina and the anal area. Now, these structures, particularly the pelvic floor, so pubococcygeus, puborectalis, stretches 3 times beyond its normal length to deliver a normal size baby. Now, that's pretty crazy, but it's possible because of the hormonal influences and the fact that labour is slow and sustained and it occurs over time. But the preparation that we do with women is just to make sure that these muscles have the elasticity so there's no barriers for that little baby's head to come down in second stage labour. So it's really about increasing the elasticity of the area, and it's important from about 36, 37 weeks, particularly pertinent if you've had pelvic girdle pain, because we know the muscles in the pelvic floor get tight associated with pain, or if you've had any sort of issues in the past with pain with intercourse, bladder pain, even back pain can tighten the muscles around the pelvis. So if you'd like to ask more, then please do via our social media networks, or give us a call. I'm happy to talk through it more.